I am Cassandra Donnelly, and we are back with another exciting episode of Inside Urgent Care. I have the wonderful opportunity today to sit and talk with our new CEO of the Urgent Care Association, Mr. Steve Sellars. Steve has been a friend of mine, a mentor, and I have been so excited about the journey that has occurred over the last few years with you stepping into this new role. And so today, I really want to have a conversation with you about what this role means to you. I want our listeners to hear and understand your passion for the Urgent Care Association, for where you see us going in the next 1, 3, 5 years, and for them to hear your vision about the UCA so that they will know, like I know, what an opportunity we have in sitting under your leadership. And as the new president of the Urgent Care Association, I get the opportunity to work with you over this next year, and I'm so excited about that.
Well, thank you so much for the kind words. I'm beyond excited to be here. You know, I've had a long healthcare journey myself. I started out on the payer side of healthcare. Spent about 7.5 years on the payer side. Then shifted to a big health system. Worked for a big health system. So flipped from the payer side to the provider side. Spent 5 years doing that, and then I was lucky enough to be introduced to the field of urgent care through a joint venture partnership that the health system had with the two founding physicians that were in this joint venture partnership, and it was early on in their partnership, and you know, these were very entrepreneurial physicians and an entrepreneurial health system that saw the need to grow the outpatient side of what they did, saw the need around access to care challenges, okay? And, you know, I was lucky enough to join forces with that organization. That was back in 2004. And so that's where I first got introduced to urgent care, okay? And I fell in love with the space. And so over time, I got more involved at a national level with the association. I used to come and speak at these events. You know, we were at a great venue here in Chicago right now, talking to each other at our convention. What an awesome keynote we had. But I used to come and speak, and I saw so much value in the networking and the convening that the organization did. And so, hey, one thing led to another. I went from speaking to serving on committees, eventually serving on the board, did a few terms on the board, chaired the board for a couple of years. And I have to tell you, I've fallen in love with this part of healthcare. You know, so I think about what this industry is doing, what the field of urgent care is doing. We are providing access to affordable, everyday care to almost 200 million patients a year.
Wow.
We're doing something right.
Yeah.
And it's at a time where there's no shortage of challenges in healthcare and in life, quite frankly.
For sure.
But no shortage of challenges in healthcare. But so that's kind of, you know, the journey that I've been on to get me to where I am today. I stepped away last year, took some time off, and you know, but had, you know, some conversations along the way with Llewellyn, her retirement, and you know, I felt like this was a space in healthcare that I still had more to give to, you know. And so I've always loved the UCA. I love the affiliated organizations. I have made some of the best, you know, of friends in this space just through the networking. I mean, that's always been my favorite aspect of what UCA does, the convening, okay? And I think that's important for us going forward. So anyway, that's what led me to come here. I'm grateful. I'm happy to be here. And in terms of vision for UCA, I see us as the voice of urgent care. You know, there's a lot of moving parts in healthcare. There's not all operators look the same.
Right.
Some are health system affiliated, some are independent practices, some are owned by private equity, some are small practices, some are large practices, some do primary care, some don't.
Right.
We don't all look the same.
Some do Ahmed.
Some do Ahmed. Some are doing a lot of direct to employer work. You know, so we don't all look the same. And that being said, we're doing a lot of things right. You know, the appeal that we have to consumers, the model, open 7 days a week. Patients can walk in or schedule an appointment, you know, through their mobile app or online, through the technology that's available today. Extended hours. We take care of a broad range of conditions. This is what consumers want. This is what consumers need. Okay, and so, you know, just to throw in one other comment, you look at some of the math problems in healthcare. There's a lot of math problems.
Right.
One of them is, you know, the state of primary care physicians, the supply versus the demand.
For sure.
Okay, if, you know, my data is correct, which I think it is, you know, roughly 22% of primary care physicians are 65 and older. Another 22, 23% are 55 to 64. So you're talking about at a time when access to care is already challenged. And then we look at some of the math problems in accessing primary care and how long it already takes to get in with primary care. Love primary care. But you're talking about almost 50% of primary care physicians are 55 years and older. Okay. And so, again, the access to care challenges are only going to get worse. And I think that's going to create even more demand for what we do. So that being said, I see us as the voice of the industry. I see us strengthening the industry through our advocacy efforts, which you've been a part of. I see us deepening our member engagement. You know, I want all operators to join forces with us. Okay, I know the value that I've personally gotten from being associated with and involved in and engaged with UCA over the years. I think you would say the same.
For sure.
It's tremendous. And so we want to deepen that relationship with operators all across the country, and ultimately just ensure, you know, for the long term that we have a sustainable industry. So that's kind of our big three areas of focus right now: advocacy, member engagement, member value. There's data that fits into our advocacy work. Okay, data is a part of that. Data is a part of our member engagement. And when I talk about members, I'm not just talking about operator members. We've got very, very strong partnerships with key vendors in urgent care. Vendors that you know, have been very loyal and helpful to us. And the more of them that I talk to, the more I see them wanting to engage with us. But advocacy, member value and engagement, long-term sustainability and growth. That's kind of my core areas of focus.
Those are your three big rocks,
Yes.
is what I
Yes,
gather.
they are.
Yeah, I mean, so I think that's so important. You mentioned, and obviously we are here in Chicago at our annual convention, and the one thing that you and I have talked about is just that purpose of convening. And it means different things to different people.
It does, yeah.
But over the years, I think you hit the nail on the head. That particular community, that fellowship, that allows you, it's huge, that allows you to engage and understand what other members are going through, what they value, to have a professional meeting where you can recognize that your competitor can give you a nugget, a pearl of wisdom that can catapult your business, and that competitor doesn't feel as though they've given away
That's
the
right.
keys to the kingdom,
That's right.
right? They understand that at the
I,
end of the day,
yeah.
we're serving so many patients. There's no way that I can serve all of the patients that need to be served.
Right.
And if there's a way to deliver healthcare in a meaningful way that allows us all to be able to have a serving of the urgent care pie, respectfully,
That's right.
we engage in that during our convention, and those are the things that we can share, and you can unload some of your problems and hear someone else's solutions there. And I kind of heard you
Yeah.
say that community, that fellowship is one thing that we engage in at the convention.
Absolutely. And yeah, again, you heard me say that's been my favorite thing about UCA. I mean, I love this organization, very passionate about it. I can think about, years ago, the people that got me involved, got me engaged. Many of them are still around today. I saw a lot of them in session earlier today. And, these are people battling the same challenges that other operators are facing. And to your point, I've never, felt in my past, involvement with UCA, never felt concerned about a competitive situation that, no, this is people coming together for the broader good of the entire industry. Again, no shortage of challenges. But so from a UCA standpoint, I think about the opportunities to convene, the opportunities to network, the opportunities to get together, the opportunities to learn. We've got our big annual convention going on right now. We've got a great turnout. I'm so excited about all the energy that we have from this. We've got our annual, we call it the Assembly, coming up this summer in July. I know you're a big part of that as well. We'll be in Washington, D.C. And the Assembly is usually a meeting of our strategic advisory group, which is the executive leaders of some of the larger operators around the country, CEOs, COOs, CFOs. And then we've got our clinical advisory group, so our clinical leaders from organizations from all over the country. And then our delegates council, which is a group of representatives that represent the operators that aren't so big.
Right.
So again, we don't all look alike from the standpoint of size or who we're owned by or what have you. I'm saying we.
Yeah. I get it.
That's another important event coming up. And we've got a number of other things that we do. And we've got a lot of other ideas too about how we can even strengthen those networking opportunities. But again, that's like way high on my list as to why I was involved for so long. I know it's the same for you. And I would invite anyone that's member or non-member,
Right.
give us a shot, get involved, join us. We're stronger together. I think we're at a pivotal point in time right now. Our voice needs to be heard. We're doing phenomenal things as an industry. Again, when you're touching 185 to 200 million people a year, that's more than emergency departments are treating, just to put it in perspective. Okay, so again, doing a lot of things well. We've got a lot of work to do on the reimbursement front.
For sure.
That's why I say advocacy is a top priority for us. UCA intends to continue to invest in that. And look, quite frankly, there's other urgent care stuff that's going on out there.
Yeah.
But I would ask members and non-members to check into are those organizations investing, at the level we are in advocacy efforts to try to better the overall industry, to bring more awareness and to improve reimbursement. And I'm talking about hundreds of thousands of dollars every year.
For sure. I think that's really important.
Yeah.
I think that when people think about, well, why should I join the Urgent Care Association? And the problems, I can fix my own problems until you can't fix your own problems. And, certainly having an advocate there for you, having a lobbyist there for you
Yeah.
when you need them, and having that support for a small urgent care that's operating 2 and 3 locations that now see a huge boulder coming at them, be it for in the realm of radiology,
Right.
and how we will service our patients that need rankinographic studies
Right.
done, be it in terms of reimbursement,
Yeah.
scope,
Yeah.
right? All of those things, be in
There's
terms
so
of
much.
how do I educate the clinicians that are coming out?
Yeah.
How do I tackle these problems? The Urgent Care Association has been in the business of tackling those problems for some time.
That's right.
And quite frankly, I would rather show up to the meeting with the Urgent Care Association beside me, right? I think we heard today that it's not about the problem in front of you. It is about the person or organization that's standing beside you.
That's right.
As you confront that.
That's
I think
right.
it's really important because that community and that fellowship and that strength that we have in numbers will be seen as we tackle many of these problems that some of the smaller companies and organizations are starting to tackle independently, and quite frankly can quickly see that they can become overwhelmed with that particular task.
Right.
You mentioned one thing about the vendors. That's something that makes our organization a little bit different, right? As you look at a medical organization and an association. And it's something that I did not understand fully early on in my work with the organization. However, I've come to understand and work with some of the vendors for so long that they are absolutely invested in our patients.
Absolutely.
And not just our organizations for profit and for what's in it for them. I have seen and worked with some of them, and I understand that they care about the long-term success of urgent care because they understand the impact on patients. And they see that the future of medicine includes urgent care. They see that through COVID and beyond, that urgent care is here to stay, and that it's a necessary whole in the belt, right, of medicine, and in the spectrum of medicine. And our vendors are so important to research. They're so important to marketing. They're so important to getting out that particular message that needs to be delivered. And they're helping us to be able to do that.
I completely agree. I'm a partnership person. I believe in partnerships. And, I've really enjoyed getting to know the vendor community better in the last 6 to 8 months.
Right.
And I have to tell you, we've got a lot of work going on right now around data and benchmarking. And in years past, UCA heavily relied on operators to report things into the organization, to put data, reports together and provide that data. It's important to tell our value story with data.
Yes.
Right? Quality data, outcomes data, data that matters to payers. And I just feel like we've got some of the most talented vendors, partners in the urgent care world, some of the most innovative companies, whether they're technology based or not, whether they're clinical, tech, whatever, service companies, whatever. We've been talking to a lot of them about how we can work more closely together for the long-term advancement of the industry. We're getting great feedback from that. So very excited about that. Talking a little more about advocacy. I mean, you've played a heavy part in that yourself. And I know we had a great visit in DC in February. We had a great audience there, multiple different groups. And I'm just eager to tell that story louder and more often. So that's another initiative for us that's kind of baked into our core priorities is telling that value story. Okay, so we talk about how vendors can help with that. That's very important, and I'm looking forward to that.
We talked about data and metrics. That reminded me of a saying that a good friend of mine, who is a chief compliance officer, she coined this term that said, "In God we trust. Everyone else brings metrics." And I think about that every time someone wants to do something different, someone wants to go a different route, and I'm thinking, where's the data, right? Where are the metrics? Where have we, by now we should be able to prove, right, the ROI,
right,
before we just launch out as we did when we were, babies and infants, right? We know better now, we do better.
Yeah, we know we provide convenient access to cost-effective health care.
Exactly.
We know that. How do we prove that we're providing high-quality health care? How do we prove that we're positively impacting the overall healthcare system? We know that 35 to 45% of patients that go to the emergency department could be taken care of in an urgent care setting. We know that. If we shift a fraction of those visits to urgent care, a third of them, a fraction of them, we're talking about saving the overall healthcare system $25 to $30 billion a year.
Billion with
billions,
a B.
billions.
And that, my friend, that particular message, that data-driven message, is not only very impactful, it is exactly what our legislators want to hear about how their constituents will benefit from changes that we want to see at the federal level.
Right.
That's what they want to understand. That data and those metrics are things that move needles. That's what changes the reimbursement for urgent care companies.
Yeah.
And I mention that because without that data, it would be very difficult for a smaller urgent care company, a smaller 1, 2, 3 urgent care practice, to be able to articulate that message alone.
Yeah.
And why should they? Why should you have to articulate that alone? The studies have already been done on that.
Right. One other point I want to make too is just around, I said we had a math problem. We got a lot of math problems in healthcare. We have power problems too. And when I say that, I mean, and I'm not, anti-profit.
Right.
I'm not. So when I say, a power problem, many of our operators have been stuck on the same fee schedule, the same reimbursement levels for 5, 7, 10 years in some cases. Okay, but what's happening with health insurance premiums? They've double-digit increases year over year.
Yeah.
They've skyrocketed. Those premium increases that the health plans are incorporating are not trickling back down to the front line everyday healthcare providers and clinicians in urgent care.
Right.
Not happening. Okay, so with that, there's a lot of frustration among employers as well. Okay, and so we've got a number of things that we're working on. You and I both know that you mentioned earlier the OC Health work that a lot of our operators do. A lot of our operators are doing direct, sort of like direct primary care type models, contracting directly with employer groups. We've been in conversations at the association level with large employer groups that they love our model. They love that access to affordable health care. We've been in touch with large employer coalitions. They love what we do. And so, I see that as an avenue or a path or a priority for us as well. So when we think about advocacy, we've got our work with CMS. We've engaged a consultant. Right. You and I both work with McDermott in Washington, working through some initiatives around CMS. And hopefully we'll see some enhancement to the Medicare physician fee schedule in time. We've been working on that for a couple of years. Big investment.
Right.
But on the commercial reimbursement side, this is where I'm talking about the direct to employer and employer coalition work. And we've got a lot of opportunity around that as well that I'm excited about. So
It's lots of good things going on right
there
now.
is.
There's a lot of things going on, but
And we need help too. And I want to just reiterate, like, join with us. You raised your hand years ago. You said, I'm going to get involved with UCA. And I remember the early days for you. But that's what we need. We need people to raise their hand and get involved. And you've spoken, you've served on committees, you've a couple of terms on the board. Now you're our incoming board president.
This is true.
Yeah, tell me about that. Are you excited about it or what?
I'm super excited. A little nervous. I got about 40 hours before
We're going to kill it, though.
Need to bang that gavel. But I am excited. I'm excited because it's a very exciting time for urgent care. Mm-hmm. I'm excited because the work to get here, although it continues, it has paved the path for a very easy transition into leadership. I have wonderful colleagues on the board, and I know that the work that we are doing is valuable, it's meaningful for our members, for our patients, most importantly. As an emergency medicine physician, I see across the College of Urgent Care Medicine, across the Urgent Care College of Physicians, across the foundation, and across the Urgent Care Board, I see the great work that collectively we do to advance the specialty of urgent care medicine that then trickles down to taking great care of our patients through evidence-based medicine, having the research to be able to pay for that, how it trickles down to bringing in and developing emerging urgent care leaders. That's one thing that I found most valuable from the conference, was that I found a place for me to come as a leader in medicine that does not automatically trickle down to a leader in operations. And that's something that gets missed at times, is that just because you deliver great patient care, or you were told that you do, and you can rally the troops of your colleagues, it may not it doesn't necessarily translate to great operations and how you handle it. And that's one thing that I found super valuable about the Urgent Care Association. That helped me to develop that skill that was so necessary. And you're right, I had that spark, I had that want to do it better, that I want to learn how to make this happen. I wanted to be able to serve the clinicians that looked up to me as I grew into that leadership role. I had a great mentor in one of our founders, Dr. Lee Resnick, who gave me that opportunity to be able to lead at our company. And after that, it was up to me to figure out, hey, how do we do this better? And as a physician, it's not necessarily something you would learn in medical school.
Right.
But the Urgent Care Association and other associations that I belong to, I'm grateful that they gave me those leadership, those tidbits, those nuggets. How do you put it all together? And for urgent care medicine, I was able to then say, okay, this is how we put it all together. And this is how we now put it all together for the advancement of urgent care medicine and our patients. And so I think it's a great time to walk into this role. I'm super excited because I get to work alongside our new CEO.
Oh, I'm excited.
I'm so happy about that. Our previous CEO, Llewellyn, absolutely a
rock star.
Just a stalwart in what she did. And I'm excited about what the future looks like.
And we're family now. Llewellyn's here.
Yes.
Laurel is here. Laurel was CEO prior to Llewellyn. I think the world of both of them. I'm grateful to still have a strong relationship with both of them. And I told Llewellyn, we're going to put her to work while she's here. So that being said, no, I think we've got a phenomenal board. They're going to continue to follow your lead, and I think about the physician leadership we have in this organization. I think 8 of our board members are physicians. Okay, and I've always subscribed to, everything has to start by providing great clinical care. Right. If you're not doing that, You can forget about, operational efficiency. You can forget about developing patient loyalty. You can forget about staff loyalty. You can forget about financial success. It has to start by providing great clinical care. And I'm excited about the leadership that we have on the board, the engagement of our board, and the non-physician representatives we have on our board are some of the brightest thought leaders that I've ever been around.
Totally agree.
And I can't help. It gets tricky when you start throwing names out. But I think about the people that got me involved in this organization. The Lee Resnicks. You mentioned Lee. What an amazing person. Okay.
Amazing.
Dr. Don Dillahunty, Dr. Nate Newman, Dr. Mark Salzberg. I could go down the list. And then the physicians that I worked with, the clinical leaders that I worked with, serving on committees and boards, and Dr. Rob Kimball and Dr. Sean McNeely and Joe Toscano, Dr. Toscano. I could go down the list. I know it's tricky when you start throwing names out because I'll leave 10 out.
Right.
But these are partners for life as far as I'm concerned.
For sure.
And many of them are here.
They are.
Which is awesome.
Yeah, I think what they taught us by that physician leadership is that what's good for medicine is good for business. And if our members and those who are thinking about becoming members remember that, I think the sky's the limit.
Yeah.
Because that's where the rubber meets the road.
Yeah.
We practice great medicine and we focus on quality, and then we focus on how we can honestly get paid doing that.
Yeah. Yeah.
So Steve, it has been a wonderful, wonderful experience sitting down with you for a few moments.
I feel just the same. I'm looking forward to it. I love this space. I want to invite, as I mentioned earlier, if you're a member, engage with us, be in touch with us. We want to hear from you. We want to hear your voice. If you're a non-member, come join with us. We need you. We need you. One team, one heartbeat, like Coach O from LSU used to say. One team, one heartbeat. So I'm excited to be here. Looking forward to the next couple of years.
Awesome. Appreciate it.
Thank you.
Thank you for tuning in to this episode of Inside Urgent Care. I am Dr. Cassandra Donnelly, and I've had a great opportunity to speak with and interview and just have a great conversation with our CEO, Steve Sellars. I want to give a special thank you to the Urgent Care Association staff, without whom we would never be able to do anything that we do in this organization. And so to our staff, to our volunteers on the boards, the foundation, the College of Urgent Care Medicine, the Urgent Care College of Physicians, we are humbled and grateful for your service and dedication, and just want to make sure that every opportunity that we have, we recognize you for the great work that you do.